Today's class is wonderful and miraculous because I don't know what's going on. Where are they? There is no wrong answer. Are you? Okay, we don't have time. Let's just start. So, okay, say it. I can hear you. Is the science of what? Okay. All right. That's good. That's good. That's a good answer. Okay. I'm trying to see. Okay, no problem. So let's just define it professionally as usual. Public health is the practice of preventing diseases, promoting health, and improving the well-being of communities through organized efforts and practices. So the major function of public health, of you studying to become a public health professional, of you, me being a public health professional, is to ensure that we prevent diseases from happening in the society, and when they exist, we find ways in which we can still promote well-being by encouraging optimal behaviors, societal behaviors, social behaviors, medical behaviors, biological behaviors. Everything come together to see that the society that we want to build, the population of the world, the communities that we live in, all have good health, and we all exist in peace and harmony as much as possible. When I say societal and behavioral, it's still emphasizing the fact that public health does not just focus on diseases. It focuses on what we do, our environments, our behaviors. No matter what it is, everything still finds a way to influence our health. You can think, oh, I just love going to parties. But those parties you are engaging in exposes one to indiscriminate sexual activities, to alcohol. I just like getting high. Can expose you to liver cirrhosis. Can expose one to accidents, because once somebody drives intoxicated, the accident can either directly affect him or her, or affect somebody else by killing an innocent passerby. Do you understand? So all this come together to make sure we as public health professionals, our work is to see that and everything works hand in hand. So public health is all about keeping people healthy on a large scale. On a large scale. Of course, whatever we want to do on a large scale has to start from yourself, has to start from your immediate environment, has to start from your home. You can't be looking at your neighbor that refuses to empty their bins, or that goes to throw their bins in the gutter. Mommy. And meanwhile, you are the one playing loud music, disturbing everybody in the community. Everybody has to come together to see that they work together and ensure a healthy society. Scopes of public health. So what does public health cover? All this is, what do we cover? What does public health cover? Disease prevention and control, health promotion. We want to promote health. Prolongation of life. So how can we make sure that people, regardless of whatever they want to do in the society, we're not here to tell you people to judge. No. We're not here to tell you the person that takes alcohol is going to hell, or the person that smokes is going to die today. No. We are here to still find a way to educate people that whatever choices you want to make, be reasonable about them, do them in moderation, and as much as possible, have them in a healthy way. Do you understand? This is our work. Prolongation of life. We are going to educate. Our work is health education. Monitoring and responding to disease outbreaks. That is one thing that most people think public health workers do. We just think our own is to concern ourselves with Ebola, with typhoid, with cholera. That's just what they think. With immunization, no. Yes, that is our work, but that's not our major work. Do you understand? Health equity. Public health advocates for reduction of disparities in healthcare system and health outcomes across different socioeconomic groups. Our work is to advocate at all times. We can't always keep thinking that it's only the rich that deserves to have good health. Go to general hospital in most states or in most communities, it is in a dilapidated state. You will never be on the queue and see the governor of your state together with you on the queue in general hospital. But our work as public health professionals is not to think, okay, when they bring the money for us to improve the healthcare system, let us eat it. Our work is to see how can we encourage the politicians to please. Yes, they have money to go and seek medical attention in UK. Yes, they have money to go and seek medical attention in India. But the people that they serve in the community, people that they serve in the states, they need to also give them quality healthcare services. They need to also have access to quality healthcare. So we are the ones that are going to keep talking. We can't keep quiet. We have to use our social media. As much as we are on our social media doing TikTok and dances, we'll find a way to still slot in that CEO, the hospital in Miri community, the hospital needs upgrading, please. Yes, so I'm here, I'm a baddie with my fine clothes, but look at the hospital I'm in right now. The tiles are broken, there's not even bed. Please, the government, you have to find a way. We can't all come and see that, yes, and the hospital in my village is not good. No. If you're a social person, find a way to impute it. Our work is, no matter what, we are going to advocate for quality healthcare. That is part of our work. That is the scope of what public health entails. So public health emphasizes on collective efforts. Just because you are a public health professional, it's not only your work. You are going to tell the Mekose by the road that please, when you finish, clean your area. The barber that is barbing, please, when you are in your barbing salon, after you finish packing your hair, don't just throw it on the road. Yes, we know hair is biodegradable, but don't just throw it away. Kindly sweep it. Our work is also to ensure that everybody works together collectively to achieve a healthy society, to achieve a healthy environment. Our work is to tell that your neighbor that please, I know you like smoking. I know it's not easy. You like smoking, but try as much as possible. From smoking 10 packs, can you smoke 1 pack? Because I'm exposed as a secondary smoker. Because you might think I don't smoke, but that neighbor that is smoking and blowing his carbon monoxide to you, you are inhaling it, which will definitely have an impact in your life, if not now, in the long run. So we all have to see that, okay, we work collectively to ensure that we achieve a healthy society and a healthy environment. So the history of public health, we're talking about the history now, did not just start today. It started from time immemorial. So in years, we are going to say public health officially was documented in the 18th century, way before the 18th century, but of course it had stages. We went to the 19th century. Everything we have today all have an origin. You're going to read them, you're going to know them for your own self. But we are in the Gen Z generation of education, so we're not going to focus on reading history and all that. You need to know your history, but that's not going to be our primary concern. We have the public health law reforms, which was developed in the 19th century. Then we now have the modern public health, which was developed in the 20th century, where we have the WHO, who have finally found a way to give it a structure. So when you talk about public health, we know the first organization that we are going to look into is the WHO, which is the World Health Organization. They now made us realize that, okay, all these diseases we've been talking about, we need to do something. And this is the structural framework that we are going to follow to see how we can achieve a healthy world. You understand? So the key functions of public health is surveillance, which is the continuous systematic collection, analysis and interpretation of health data. This enables early detection of diseases. So if we're able to always be on board to see what can we do, how can we find out about these diseases, how can we quickly acquire data, we are going to be 10 steps ahead. But of course, no matter what we do, we can't always have everything perfect. And that is how COVID-19 caught us by our legs and our hands. And we had to shut down the whole world when it happened. But in the past, when such pandemic occurred, a lot of people died. And they had little to no ways to curb them. But imagine, immediately when it happened, we only had lockdown for almost only maximum, like the physical lockdown, the actual lockdown was just at most 9 months. In the past, people did not even know that they had to be on lockdown. So they kept on spreading the diseases. Some diseases were supposed to just be in a set, maybe in one island. But because they didn't know they were supposed to be locked down, those diseases found their ways all the way from Asia to Africa. So we might have thought that the lockdown was detrimental to our financial and economic growth, but at least it had a positive impact in the fact that we were able to quickly manage the disease, and you and I are here today. You and I can count the number of people we personally know that contracted COVID-19. If possible, we can even say we don't even know anyone. Most people don't even know anyone personally. But assuming we didn't have this surveillance for public health, quickly, systematically collecting and analyzing data to enable early detection, the damage will have been more. An example of that kind of organization responsible for that is the NCDC or the CDC, Center for Disease Control. Then we have the Nigerian Center for Disease Control for us in Nigeria, NCDC. So we have policy making. Our work is to make policies. Everybody has a role to play, but anything health related, the policies that revolve around health, is our responsibility. You're not expecting Tinubu to come and tell you what you should do about tuberculosis. It is the role of a public health professional that is going to make the policies that the government will hopefully implement. Then we have health promotion programs. We are going to organize programs. Something like this I'm doing is also a program. Yes, it's in a structural institution, but it can also be, you can organize programs in your community, in your school, in a university, in your churches, in your mosques. As you are training to be a professional public health practitioner, don't wait for somebody. You can decide. You just take, okay, you and your friend or you and your friends, you just, okay, Pub 101 class today, 100 level technician class, we want to organize a health promotion program. We can do that. So now we're going to say, what is the difference between public health and medicine? Because we don't really know. We're not doctors, but at the same time, doctors think they are us. Do you understand? So what is the difference between this public health and doctor? So we focus on population, they focus on individual health. A doctor's work is to look at his patients. When you come, I have headache. After that person with headache has gone, the next person, I have stomach pain. After the person with stomach pain has come, the next person that comes, I have leg pain. That is the doctor's function. Our work is to population. Okay, everybody in this hospital, why are you all here? How can we help you? Everybody in this hospital, how can we make sure that you come to this hospital with headache and you don't leave with stomach pain? How can we make sure that as you're entering this hospital, the door in the hospital does not tear you and they will end up having to admit you for stitches? Do you understand? Can you see the difference? Our work is the whole population of that hospital. Our work focuses on I'm just giving an example, everybody coming to that hospital. Our work is to see how can we make sure nobody gets infected with a nosocomial infection. You know what are nosocomial infections? They are diseases one gets when they come to the hospital. You came to the hospital for headache, but suddenly you are living with rashes or with chicken pox, because Obviously, the patient just came and sat down with chickenpox. Doctor, I have chickenpox. Oh, you have chickenpox? Okay, don't worry, go and rub calamine lotion. But meanwhile, when the patient sat down, the chickenpox touched the chair. The water from the chickenpox touched the chair. And you that came with just ordinary headache, you came and sat down, you did not know. And suddenly you went back home, chickenpox has caught you. And you'll be wondering, where did I get chickenpox from? You didn't know it's when you went to the hospital. So public health professional is to ensure that immediately after that patient leaves, the cleaner uses sanitizer to clean that seat. Or you as a patient, when you come, there is a sanitizer available for you on the table for you to clean the chair you're about to sit on. Or the public health professional is to ensure that everybody in the hospital wears face mask. You went to the hospital with a headache, and because somebody that had tuberculosis came to meet the doctor and was coughing, doctor, I have tuberculosis. Then the sputum splashed everywhere on the table. The doctor himself can contract tuberculosis from patients if he or she does not wear face mask. So our work as public health professionals is to educate everyone that you that is coughing there, please kindly wear face mask. Immediately you come into the hospital, there is a face mask available at the front desk. Pick one and wear. Of course, there is no money in Nigeria. So they will tell you, come and buy face mask, 100 naira. Buy it. It is for your own good. If you don't want to buy it, buy the one that will be in your bag and you can be using all the time when you enter hospital. Do you understand what I'm saying? Prevention and health promotion versus curative care. Doctor's function is to care, is to cure. That is the doctor's function. Our function, you and I, is not to cure anybody's disease. Our function is to prevent it from even happening in the first instance. There is diabetes, doctor will come and give you medicine like this. Our own is to keep educating people. Please and please, you are not doing me a favor, you are doing yourself a favor. Stop drinking 5 bottles of Coke. Drink water. I know Coke is sweet, I know Fanta is sweet. Drink water to prevent diabetes. Exercise. You must take this Fanta. Exercise. This power horse, this energy drink you are addicted to, reduce it. Reduce that energy drink you are always consuming. That is our, is to prevent the diabetes from happening in the first instance. That is our work. The doctor will try their best to educate you, but they are not going to keep on singing to you and be telling you. They will now carry microphone. Although now, thank God for social media, so everybody is doing the work of a public health professional now. But our own is to educate, to ensure, to prevent the disease from happening in the first instance. So we'll just say doctors focus on treatments, public health professional, public health as a cause, as an institution, as a profession, as a career, focuses on prevention and management. So we'll say we're only able to do one class today. Should we continue? Do you have another class? You have a next class, right? So till next week, hopefully please try and connect early next week. Immediately you experience any connection problem, quickly call Mr. Jamil, please, so that we don't have to. This course is bulky, very bulky. You have 14 topics, but we are going to simplify it, of course, isn't it? We're going to have fun, and we're going to make sure we understand and fall in love with this course that you all have decided to venture in as your future career. So if you have any questions, can you, there's no time. So next week, I'll send you the notes, you read them. If you have any questions, you ask them in your next class. Make sure you read the history parts. Just read it to know, because I'm going to ask you in class about the history. Who discovered smallpox vaccine? I'm going to ask you next week. So I want you all to be alert, to be aware, and to be ready and to be interested and committed to what we're about to venture in. It's going to be a smooth ride, don't worry. So have a lovely day. Bye. See you next week. Bye bye. Yeah. Take care. Yeah, bye. Class was nice. I don't know, you didn't hear them, but it was nice.